One of the questions that I get asked frequently is about deciding which clinical trial to pick. There are many institutions that might have quite a few that a patient is eligible for, and how do you know which one is best? So there are lots of features of the clinical trials that the doctor may be able to help you with in terms of is the drug similar to what the patient has had before? Is the mechanism similar? Is it different? We want generally a clinical trial patient to be getting a drug that's quite different from what they've had before, or at least in a combination that's different from before. Also, there are specific toxicity profiles that can be helpful in selecting the right drug. There are certain profiles that one patient may be better able to handle than another. Also, in addition to that, there are definitely feasibility and logistical issues that help make the decision on clinical trials. Some are in the hospital, some are out of hospital, some require much more frequent visits to the center than others. So actually, if you're not sure which one is better, you may as well pick the one that is more convenient and feasible for you. And then, of course, every once in a while for later stage trials, the investigator may be able to tell the patient with a little bit more certainty what the likely outcome could be, because trials which have many patients on them may have preliminary data that were reported that might be helpful in making the decision, whereas much earlier clinical trials will typically not have any information about who's been helped or what the response rates are, which makes it hard for patients to decide.